So for those of you who follow me on Twitter, you probably know what my position is on what I call non-medical switching. So one of the things that I don't want anyone to take away from this is biosimilars are not bad therapies. They undergo a very thorough regulatory process, and in Alberta, there are patients who need to start a biologic and for the first time, and we will start the biosimilar medication. And in that patient population, my feeling is that it works as well as the originator. Switching is different when you take a person who's on a stable drug for a long period of time and you're making a switch to a biosimilar. And the reason that this switch is often made and policies surround this is because of the cost of the drug. These biosimilars come with at least a 30 to 40% savings in cost to the healthcare system. Now, if the cost was the same, you would not want to switch a patient, right? And Paul will go through it, Dr. Moyetti will go through the data. But I think that decision really needs to be made by the physician and the patient. I don't believe that it should be made by a third party who's doesn't have, for a lack of a better word, skin in the game. I think it needs to be determined in an individual patient basis. We do have patients who have a very broad societal view who've said, I'm happy to switch even without a switch policy. So that's an individual patient decision. It needs to be supported by scientific evidence, and Dr. Moyetti will go over this. And most importantly, it needs to be performed only with patient awareness. So there needs to be that discussion between the physician and the patient needs to be aware when they are going to be getting their first dose of biosimilar, if that indeed is going to happen.